Welcome everyone. In this episode, we are discussing about the role of physical activity in public health, and we have an amazing guest for this episode who can really give perspective on this matter. Our guest has started his research career in 1972 in University of Oregon and has since then worked in almost every position and roles imaginable. Currently, he is working as Distinguished Professor Emeritus of Exercise Science and as the Director of Children's Physical Activity Research Group at University of South Carolina. He has authored 9 books about fitness testing, coaching, and physical activity interventions and strategies. He has published over 400 peer-reviewed scientific papers, and those papers have been cited over 111,000 times. And if that is not enough of accomplishments, he has finished prestigious Boston Marathon on 7th place with time of 2 hours and 15 minutes. Ladies and gentlemen, please welcome our guest, distinguished Professor Russell Pate. Welcome,
Well,
Russell.
well, thank you so much, Ole. It's wonderful to be with you, and I appreciate the very kind introduction.
Yeah, it's really an honor to have you. So maybe we start shortly with the Boston Marathon. How was the race in 1975?
Well, I had a good day. Anyone who's run competitively knows that there are days when it's difficult, and there are days when it all seems to come together. And that particular day was one when it all came together for me. I felt good that day. I had a nice tailwind, and Boston is a one-directional course that it runs west to east, and we had a nice day for it. Weather was good, and I happened to have a good day that particular day.
Yeah, and I read about it that Bill Rogers actually ran the American record on the same race.
You did, yeah, um,
Yeah.
yeah. It was a little like old times day because I knew Bill Rogers when he was still in high school, and I remember vividly when he came by and during the race, and it looked good. And we spoke briefly, and he went on, and he had a great day.
Yeah, yeah. Yeah, no, that's really interesting. And so if we go a little bit more into your research things, how is your research at the moment? What kind of things are keeping you busy at the moment?
We're busy. Yeah, our overriding aim of my research group is to understand physical activity behavior in children, and we are particularly interested in learning ways that physical activity can be increased in young people. Um, our work started really at the older end of the child adolescent age continuum and has gradually worked down. And for the last 15 or so years, we've worked with young children of preschool age, 3 to 5 year old children, and we're currently involved in a study that is focused on even younger children. We followed around 140 originally babies that were 6 months old uh, up to 36 months of age, and we're very interested in learning how their physical activity levels change over that period of time, and we hope to learn, if we can, factors that associate with their change in physical activity. We're also studying other behaviors, including sleep behavior, and how that may associate with their physical activity. So we've gradually worked down the age continuum, and hope that we will, in the not too distant future, learn something about physical activity in very young children that have not been studied frequently, in this, in this sector.
So you start with such a young that 6 months of age. How do you do the measurements? How do you follow the
Mm-hmm.
physical activity?
We use accelerometers, which are as many in your audience will know, are motion sensors, electromechanical devices that can be attached to the body and that detect motion, and they can be um, uh, used as indicators of physical activity just based on the raw counts that are recorded in the computer chip in the monitor, or they can be calibrated and linked to intensities of physical activity. Um, with very young children, the method for transforming the raw accelerometry data to intensities of physical activity really hasn't been done yet, and our group hopes to be able to do that work in the not too distant future. So we're using accelerometers at two sites. The very young children are wearing a monitor at the ankle and then another at the waist, and uh, we're looking at how that activity changes over time, uh, as indicated by the accelerometry data collected at each of those two sites. Of course, when children are 6 months of age, they're not ambulatory yet, and consequently, we think the ankle uh, indicated physical activity data may be more reflective of their overall physical activity than the activity at the waist. But once they're up and ambulatory, then we think the waist monitor may um, be a better reflection of their overall physical activity, and that's something that we hope to learn here in this study that we're engaged with at the present time.
Hmm. And what kind of practical challenges you have faced doing the measurements with the ankle and waist accelerometers?
Um, keeping the kids wearing them, of course, and we're very much indebted to the parents. Usually, the mothers are the participant in the research, and we've had great uh, um, good fortune in this study. Not only have the mothers been very committed to the study protocol and have really done a great job of keeping the kids wearing the monitors across the longitudinal period that we're following them. We're almost done with the 36-month data collection, so we've had very good compliance to the protocol. But we've conducted this study during the COVID shutdown period, which could very easily have thrown us off track, and we did have to make some modifications to the protocol because of COVID. But we were very fortunate that we had been through two measurement cycles with the moms and the babies before COVID, and so they were familiar with the protocol, and
Mm.
we were during COVID a little more reliant upon the mothers to to do some things that we ordinarily would do, but we were trying to not have direct contact with the kids. So the moms were great, and we made it through COVID with not too much loss of data, and expect to be able to do the longitudinal analyses that we've planned for quite some time.
Hmm. Yeah, it's quite interesting that they are not ambulatory in the beginning, and you are having the sensor in the ankle, so it's kind of open kinetic. It's the leg is moving in the air. Do you still
Mhm.
plan to use the same way that you use kind of threshold and counts, or how do you plan to analyze or have analyzed the data?
Yeah, procedures have been developed for toddlers. So when they get up, to a year and a half to 2 years of age, there are procedures that have been developed previously to transform accelerometer counts to minutes of physical activity at a particular intensity. But if we're going to do longitudinal analyses all the way from 6 months, on up to 36 months, that will have to be at this point dependent on use of the raw counts as indicative of physical activity. And so, there's a metric based on the accelerometry data that we'll use, for those longitudinal analyses that begin with the kids before they are ambulatory.
Mm. Yeah, really, really interesting study and really interesting topic. But actually, our plan was to more talk about the role of physical activity in public health. So, would you like to start with the history of this?
Well, it goes way back. In some ways, I think of physical activity as the new kid on the block in public health in many ways. But the idea that physical activity is important to personal health and therefore the health of populations and community residents goes way back. The early Greek scholars and physicians, presumably based on their own experience, we don't know that they had any, anything that we would call research, available to, base their conclusions on. But apparently, on the basis of their lived experience, they certainly seem to be convinced that physical activity was important to health, and they communicated that through their writings, and so in a sense they were the first physical activity specialists in public health. But fast forwarding a number of centuries, public health became a professional pursuit in many parts of the world in the 1900s. Really, the early 1900s is when public health started to become a focused profession, and physical activity really was not conceptualized as a component of public health. Around that same time, school-based physical education became quite common, and I think the argument that was made by advocates for school physical education in the late 1800s, early 1900s, really was based on health and fitness. So, I sometimes think we could look back to uh, the institutionalization of physical education in schools, particularly in Europe and North America, as a first major investment in physical activity in a public health application, because obviously the public schools reach all the kids, and so I think that development can be thought of as a kind of a physical activity in public health um, startup. But from that point on, public health really developed with a focus on infectious disease prevention, and then really after World War II started to take on chronic disease as a focus, as it became evident in populations that cardiovascular disease and cancer and diabetes and other chronic diseases were becoming major causes of morbidity and mortality. Uh, but it really was not until uh, the 1990s that physical activity came to be recognized as a legitimate focus of public health. And um, I think there was a sort of a salient development at that time. And it was the release by the American Heart Association, which in the US is a very large and influential not-for-profit health organization. The American Heart Association released a so-called statement on exercise that uh, essentially declared that physical inactivity, lack of reasonable participation in physical activity, should be considered a major risk factor for cardiovascular disease. And I think in some ways that official declaration by that very well regarded organization opened the floodgate. I personally feel that the evidence to support action related to physical activity and public health was there in the research for a good period before that. But it took time, I think, for people to for the evidence to accumulate to sort of a critical level in the research, and then for influential policy advocates to, I think, internalize that research, come to recognize it and respect it, and then finally to act and make that statement. So as a university researcher, obviously I believe research is important, and I think in this case it's been really important. I don't think there's a chance that our field would be as established as it is, and I'll say before we finish today that it's not as established as I think it should be. But I think beginning with the work of Jerry Morris and Ralph Pathmavarger in the 1960s and 70s, often large scale epidemiologic studies on employees that were variably physically active on the job, started the process, and then a number of other large-scale epidemiologic studies came along that basically showed the same thing, and it was that people that were more physically active were at lower risk for development of coronary artery disease, and that was the primary outcome studied in many of these studies. But as that research accumulated, more and more outcomes were studied. Type 2 diabetes and eventually cancers and so on. And so that epidemiologic evidence, I think became quite convincing by the early 1990s. And that was layered on top of, a very substantial body of experimental research, really exercise physiology research that showed that, excuse me, in the short term, an increase in controlled exercise sustained over a period of at least weeks and months produced physiologic changes that were consistent with the findings of the epidemiology. So, the controlled exercise studies were showing beneficial effects, for example, on blood lipids. And, a better blood lipid profile is, of course, known to be beneficial in terms of population risk for cardiovascular disease. So we had a growing and substantial body of experimental physiologic research, and we had a growing and quite substantial body of epidemiologic research that sort of came together by the early 1990s, and I think made the convincing case that we really need to speak to the public and practitioners about this important impact on public health. I think I don't think the physiologic research alone would have done it. I think we really needed the epidemiologic research layered on top of the physiologic research to make the convincing case, because obviously the epidemiologic research, in a sense, those findings can be extrapolated up to the populations in which the research was done. And, I think the findings of that body of research showed that, not only was there a beneficial effect of physical activity, but it was a substantial beneficial effect, that it was quite profound, and the so-called population attributable risk associated with this physical activity behavior was quantitatively important. So that got us to the point where there was some in the early 90s official recognition of this science and its importance to to public health, at least in the cardiovascular disease arena. But I do think it did, as I say, open the floodgate, because um, in just a few years after the release of that statement, um, a number of groups around the world, including here in the U.S., began developing physical activity recommendations or guidelines that were released to the public. There was the development of focused, kind of specialty centers in colleges and universities to sort of develop professional training and to expand the science. And there was finally at that point the development of professional practice in public health organizations, including here in the U.S. in the Centers for Disease Control and Prevention, and in a number of health departments and in developed countries around the world, in Europe in particular, but Australia as well. So was a foothold. It was became more than a statement. People began to act on that. And I think that was important. I think it continues to be important. We had a U.S. Surgeon General's report on physical activity and health, and those of us in the U.S. know that it's not easy to get the federal government to produce a Surgeon General's report. Those are major projects, and so that was clearly an important step. And I think part of the impact of these initiatives that kind of played out during the 1990s and the early 2000s was to present an image of physical activity as a part of a person's lifestyle that was not necessarily focused on highly intense structured physical activity. And honestly, I think we know we've still got a job to do in this area. But the traditional image of say a committed quote exerciser, was someone that probably pursued the exercise in a very planned, structured way. They probably went somewhere to do the physical activity. They probably dressed in a certain way to do the physical activity, and the physical activity was probably pretty intense. They were working pretty hard, and sweating and breathing hard and so on. And of course, I think we do know that that structured, maybe fairly continuous, intense approach to exercise does provide health benefits. So it's certainly not that that's wrong, but the epidemiologic research, I think, showed pretty clearly that to be beneficial, the physical activity didn't have to be intense, didn't have to be continuous, and didn't have to be performed in any particular way. That it could be accumulated throughout the day in relatively short bouts, and that the intensity of the activity could be moderate. Maybe even light, but I think we're still learning about light intensity physical activity. Although I would speculate that eventually we're going to decide that intensity is not as important as we once thought, and it's really the accumulated total dose of physical activity that maybe has the biggest impact. But we'll have to revisit that maybe in a decade or so when more research is accumulated. But we've had a job, really, I think, ever since the epidemiologic research began accumulating, to communicate to the public that while intense structured exercise is just fine, if that's your thing, the activity probably doesn't have to be that intense or particularly structured to be beneficial. And so that I was involved in the mid 1990s in the release of the production and release of the American College of Sports Medicine Centers for Disease Control and Prevention recommendation on physical activity and public health, and learned when we released that paper that that this image of physical activity as an intense, structured behavior was very established, very locked in. Um, people had been taught that approach, in school, and by people that they saw as expert authorities, and when they were, they weren't wrong about that. Um, it's just as the research evolved, our understanding of this behavior changed a little bit, and I think ever since we've been, working to convey that more moderate, accumulated physical activity provides important health benefits. And of course, the hope is that by incorporating that uh, less structured approach, that activity will become accessible to more people, enjoyable to more people, and a part of regular lifestyle for a larger and larger number of people.
Mm.
We've had
And
since the 90s, a huge challenge because as we've learned more about physical activity and how it impacts health, um, it's true that there have been changes in societies during that period that, if anything, heightened the need for us to do better with promoting physical activity. So, just knowing how much physical activity provides health benefits is not enough. We've got to figure out how to help a lot more people, meet those guidelines. And the challenge gets, I think, greater every year as our societies evolve in the direction that requires less and less physical activity for survival, just for basic
mm,
existence.
mm. Yeah, that's an interesting story from the history, and you've been there starting your research work in 1970s and being a marathon runner at that time, and you said that only 1990 the AHA publication was kind of a floodgate. How do you see now, looking back from the, for example, 1970s? Did you have an idea that physical activity would be so beneficial for different chronic conditions? What was how do you see it now, looking back?
I do think many of us intuitively uh, had the sense that physical activity provided enormous health benefits for populations, um, but admittedly the evidence was thin at that time.
Mm,
So much of the research that had been done on exercise really had been done in a structured laboratory, controlled exercise training um, application, and had not, by and large, focused on health outcomes. I've gone back and looked at this, and much of the research on exercise in the first part of the 20th century and really up into the 60s was very focused on function and not so much focused on health outcomes. But I do think even at that time, um, there was an underlying sense that you were physically active, certainly to promote fitness and function, but that there were important ancillary health benefits associated with it. I don't think that was a foreign idea at that time. I think it's just looking back at it, we weren't studying it in that mode. But I think
mm,
as the epidemiology came along, I think the physiologists looked at that and said, we need to explain that. I mean,
mm,
epidemiologic research, tells you. what are the health outcomes, maybe in a large representative sample of a population. But epidemiologic research usually doesn't explain the underlying physiology that may explain those observations. And so what I think happened was, as this epidemiology began to roll out and show these very important benefits to chronic disease outcomes, physiologists cranked it up and said, we've got to explain that. We've got to understand how that can be the case. And so that, in the intervening decades, there's been a huge volume of really health-oriented physiologic research on physical activity.
Mm. Yeah, and how did you then, still thinking of the perspective back then, did you think about light activity at that point? It was much about kind of heart rate going up,
Yeah.
moderate to vigorous. Was there any kind of ideas even that the light activity could be important also?
No, I don't think so. I've sort of looked at this, and there's an interesting example in uh, the American College of Sports Medicine's uh, guidelines on exercise testing and prescription. And so the American College of Sports Medicine began producing this clinical guideline document in the 1970s, and it's been updated every 5 years since then. And if you go back and look at the specific exercise prescription guidelines in that very first iteration of the ACSM clinical guidelines on exercise testing and prescription, uh, the parts of that recommendation have stood the test of time. Is it 3 or more days, 20 or more minutes of exercise, aerobic activity? What's changed dramatically is the recommended intensity, which in that very first book was 70 to 90% of you know, uh, aerobic
Mm.
maximal aerobic power, and that's intense exercise. A lot of people can't do that very long. And but then in succeeding um, editorial updates of that guideline book, the recommended intensity zone gradually came down to be
Mm.
inclusive of at least moderate intensity. Now it's not inclusive of light intensity at this point. I don't know if that'll come. It might, but I think partly through research and partly through experience, um, people figured out that the intensity of activity didn't have to be at the high end of the continuum in order for the activity to be beneficial to health, but also maybe more tolerable to a lot of people.
Mm. Yeah, so basically the aerobic have come down the intensity. How do you see the role of strength training there? Now it's quite just generic. There's not really too specific guidelines, and I would think that the in the strength training part, it could be that the recommendation goes that you should do more intensive and maybe even like explosive, or at least with the high speed, because it's about activating the biggest motor units that you need even when you are older. How do you see, what do you think, where will the strength training recommendations go?
Yeah, I think um, guidelines on strength training have gradually become more prominent in physical activity guidelines documents, developed around the world, including the World Health Organization. But I think that strength training, in a sense, over the last 3 or 4 decades, is probably in a health context has moved from very much in the background to an increasingly prominent position in guidelines recommendations. So that now in the latest iteration of the U.S. federal physical activity guidelines, there's very clear recommendation on resistance exercise that's a part of part of the recommendations for older adults, working age adults, and school age kids. And I think that's appropriate. And if anything, I think that'll probably become a more prominent component of of public health guidelines on physical activity.